Hi everybody, Dr. Stu Katzen here for another episode of our video series on taking care of our spinal health. Today we're going to be talking about problems that can happen in the mid-back, or problems we call the thoracic spine. In other videos we described different areas, so once again for review, cervical spine is the neck, thoracic spine is the mid-back, lumbar spine is the low back. You have 26 bones in your spine, each one's freely movable. You have 7 bones in the neck, 12 in the mid-back, 5 in the low back, in the lumbar spine. What we're going to be focusing on today specifically is this thoracic spine, this mid area. Is becoming more thing to be concerned of the last couple decades because we spend so much time sitting at a desk or sitting in our cars. So technically the normal anatomy is the spine should be straight from the front, and you should have normal curves from the side and normal curves within the normal range. What happens over time due to poor posture, poor sleeping habits, strenuous exercise, sitting in front of our computers, a lot of times we lose some flexibility and mobility in this mid-back area. And sometimes when we work with our CrossFit athletes, we'll talk about thoracic mobility, mid-spine stability. And unfortunately, all too often, people start developing postures like this, sitting at their computers, text messaging, backpacks. And then when you ask them to stand up straight or when they're trying to exercise, their bodies can only come up this high, and quite often they sometimes say their shoulder problems, but a lot more times than not, it can be a mid-thoracic problem because the spine isn't flexible, mobile enough. So basically you have 12 bones in the spine, 12 thoracic vertebrae, and each one is freely movable. And they should be lined up properly. Now what happens due to reasons I mentioned earlier, poor posture, poor sleeping habits, strenuous exercise, athletic exercise, the spine can come out of alignment. When that occurs, it can irritate the joint. It can also irritate the spinal nerves, and can stretch and elongate the muscles. So we talk about the anterior chain muscles and the posterior chain muscles. So a lot of times we become anterior dominant, that causes everything, and the back muscles get weakened. Sometimes the back muscles can go into spasm, so that can cause the spine to come out of alignment. So we want to rule out whether it's a joint problem, rule out whether it's a disc problem, rule out whether it's a nerve irritation problem, rule out if it's a muscular strain or sprain or strain. Or maybe a combination of all of the above. So that's why we want to evaluate and not in some ways self-treat in the beginning stages to make sure everything's functioning properly. And then besides then getting people the treatment they need, then give them recommendations to maintain their own spine and take care of themselves through flexibility, mobility, strengthening. So with those 12 bones, if they come out of alignment, they can cause irritation. So if we can actually help give people posture enhancing exercises and also realign these vertebrae and find out what's going on, we can give them some relief from their discomfort, make them function better. And this area of the spine, last but not least, is very, very important, especially for the athletic community, because I also want everyone to understand that the nerves that come off the spine, that's how the brain communicates with the rest of the spine through the nervous system, through the autonomic nervous system. So I read an article once where they said 80% of the Olympic athletes use chiropractic on a regular basis. And why is that? Because in the survey came out, they felt it enhanced their athletic performance. Because if we're taking pressure off the nervous system, it helps with balance, coordination, agility. These nerves also go to the heart, the lungs, the liver, the stomach. Be very important for an athlete to have full breathing capacity, full heart function. These are all tied in with each other. We're focusing on the pain and discomfort, so by realigning the spine, we can take tension off those joints and off the soft tissue structures. However, it's also important to understand that especially this particular spine also innervates organ function as well. So if you have any further questions, don't hesitate to ask me while at the office or at the CrossFit gym. Feel free to call the office if you have any questions. Also you can get my information over at the CrossFit gym at CrossFit Main Line at Wayne or Ardmore. And if you guys have any questions, we're always here to help. And good luck. Thanks.